I currently serve as the director or coordinator for the Forensic Services Program at the Johnson City Medical Center. It's the only hospital in Northeast Tennessee, actually it's the only hospital I found that has a forensic program from Knoxville to Asheville. It's the only place that patients who have been victims of violent crimes can come to receive forensic care. When I was compiling numbers, I realized that we were very lacking in keeping track of our statistics and what the cost is to victims of violent crimes. Predominantly what we see are domestic violence and sexual assaults and rape. From the sex trafficking perspective, we are underserving this population. We don't have the education to educate our frontline nurses and staff to be aware of the possibility that we could have patients who are involved in sex trafficking. We had a total of 112 patients. It's obviously very predominantly female. We see very few males who come to our emergency department for domestic violence and sexual assaults. In 2012, those numbers were pretty comparable to the previous year. The biggest impact our program has is lack of funding. I was looking at one female patient who, it was a very simple, I know that sounds terrible, a very simple domestic violence. She ended up getting a black eye. TennCare reimbursed the hospital $32 for almost $1,000 stay in the emergency department. Our program is not seen as a priority. Domestic violence patients are not seen as a priority unless they have severe injuries. These patients are a priority. These women have reached out to us to seek medical care, and we are obligated and we want to provide that care to them. Most of our patient base has no insurance. We never turn anybody away for not having insurance, but at the end of the day, that impacts how a hospital functions and how an emergency department functions, unfortunately. If you'll go to the next one, please. There's two patients I want to tell you about just briefly. The first one, her name's Amanda, and I have, of course, changed her name. I saw her last year. She came in after being held captive for 3 days by her husband. They had been married for almost 10 years. No history of violence in the family whatsoever. She was 28 years old when I saw her. She ended up having a 10-day hospital stay costing close to $243,000. She had a minimum wage job. She was a clerk in a convenience store. She ended up on the ventilator. She endured an emergent hysterectomy to save her life. She never had children, and she never will. She also had to have a colostomy as a result of the trauma that she received. This has greatly impacted her life. To add insult to injury, the perpetrator, his status is unknown. We have no idea where this man is. He could be in Johnson City or he could be in Alaska for all we know. She lives every day with the knowledge that he could come back. She's had to change jobs. She's had to move to different locations out of fear. And I do occasionally get to see this lady and speak to her about what's going on in her life. And it's been a very difficult struggle for her. The second lady, her name is Elizabeth. She also came through the emergency department with domestic violence. The perpetrator would wake up their son in the middle of the night so he could watch him beat up his mother. Nurses, we take everything to heart because, we can see ourselves and we can see their struggles, and that is a struggle for us. We have a very high burnout rate. Having to see this lady and witness her injuries and treat her injuries and deal with her son, whom she brought to the emergency department with her, and he didn't understand because he was only 4 years old. Why mommy, why does mommy have to go to surgery? Why does mommy have to do all of these other things? So to add that extra financial burden, that enormous impact on the healthcare system to try to pay for these services, they simply can't. The Violence Against Women Act, it reimburses the hospital $750, which means she would be, responsible for, say, $240,000. They don't have that kind of money, neither do I. I can't imagine having to endure these horrible traumas and then endure the fact that you can't pay for the services that you got. You shouldn't have to. They didn't do anything wrong. They were victims of violent crimes perpetrated by people that they knew and loved. If you'll go one more. That's okay. I'm a little slow on the uptake the first thing in the morning, too. started looking at financials and ongoing expenses for our program. Forensic nurses are that go-between between the healthcare arena and law enforcement. We kind of know both sides of it, and we can kind of see things from the healthcare perspective that, you know, other healthcare providers may not understand or may not realize. And like I said, $32 was $500. That was our expenses for 2011, was a little over $2 million. And that doesn't include the resources of using frontline ER staff, or emergency department staff, I should say. It takes over $10,000 to train one nurse as a forensic nurse. In the 9 years that I've been affiliated with this program, I have precepted 18 nurses. I have one nurse left. I cannot keep nurses. We have a gigantic burnout rate. I was supposed to, you know, be home last night by 9 o'clock when my shift ended. I didn't get home until 1:30 this morning because we had a patient who came in who was a sexual assault, and you can't walk away from her. She needs that specialized nursing care. It takes a nurse out of staffing 2 to 4 hours to complete an exam on one patient. That seems like a lot of time, but if you have a patient who has been a victim of a crime, do you want to rush her through this? Do you want to say, hey, I've tick-tock, I gotta go? Absolutely not. They take a lot of time and they take a lot of resources, and that's not necessarily a bad thing. Our budget, they were asking me about what my budget is. I have no budget. Unfortunately, I'd like to get one, but we are lumped under the emergency department. Forensic patients, domestic violence, sexual assaults are not a priority. They're just simply not. They may sit for 2 to 3 hours in the waiting room just to be seen by a nurse if we do not have a forensic nurse available. Our equipment and everything that we have to purchase, the training that we have to pay for, technically comes out of the emergency department budget. And with the face of healthcare changing, we're bumped even farther down on the list. We are very, very fortunate to have a private company in the community who supplies us with our equipment, because without them, we would not be able to do the job that we do now. And we do walk a tightrope. It's a very difficult job to deal with these ladies who have endured such terrible circumstances at the hands of someone that they loved. We try to follow up with them, we try to keep in contact with them, but sometimes we just simply can't. They can't stay here. They have to go somewhere else. Not only do you have the dollars and cents of what a CT scan costs or what a pregnancy test costs, but you also have the emotional toll that it takes on the patient, and then it also takes on the nurse and the healthcare provider who's providing care to them. And I will be the first one to tell you, I carry a lot of these patients with me. I can simply hear the name of somebody and reflect back to, you know, a patient that I've recently seen, or even patients that I've seen years ago. I know I'm talking very, very fast. You're okay. Okay, I didn't know if I had time left or not. It's an emotional roller coaster for us. I'm ecstatic when I was asked to come to the council and present at the hearing to get the word out to people that domestic violence is a problem in the state of Tennessee. Sexual assault is a problem in the state of Tennessee. All of these things are, and I'm so glad to know that there are 3 wonderful ladies who are bringing that to the forefront.
Thank you, Tessa, very much. We have, as I said earlier, 21 members on the council. At our other hearings, we've had anywhere from 16 of us here to 5 of us here to 3 of us here. But one of our council members, a member of the legislature, Representative Dawn White, when she is present, always asks the presenters if you could have any legislation you wanted to address these issues. Do you know what that might be?
As far as legislation, me personally, I would love to see all violence against women be Class A felonies with a minimum sentences of at least 20 to 25 years, but maybe
Okay.
I'm a little hardened, maybe.
No, I think your life has turned you that way.
Yes, I think it has.
But we have heard something along those lines before. The other thing in the healthcare industry that we've heard and that I've noticed is sometimes it's very difficult to know when a person presents in the emergency room if it really is domestic violence or not, because there's a couple reasons. They don't admit it. And the other is there aren't any CPT codes that we know of. It's very hard for healthcare industry to track the numbers, how much money they actually spend on domestic violence. And that's probably the reason somebody asked you for your budget, because we're trying to get our arms around how much money is going toward domestic violence and sexual trafficking. It's very difficult to get that number because, as I said, in healthcare industry, there's not a specific code that the healthcare industry can use to code that and then to track it. So we have also heard others say that they wish, and that's done at the federal level, that there might be some recommendation toward having a CPT code so that it could be used for domestic violence and sexual trafficking cases. So,
a lady last week who came in for headaches for migraines. And it's just that experience of knowing that something's just not quite right. I'm 98% certain that the person that was with her boyfriend, was beating her. I'm almost certain, just based on the bruising and patterns that I saw, that an average nurse may not pick up on.
right.
But trying to get those two people separated so I could speak to her, I could not get him. He would not leave her for any reason whatsoever.
You're right.
Yeah, and so if you go ahead and you take that next step further and you notify law enforcement, they're going to say, "Oh no, everything's great. We're madly in love."
Right.
And I know that I can almost guarantee you that he will continue to beat her.
Right. Well, thank you, Phyllis.
Tessa, and I do love your name. I did have to practice it.
Accent spelled backwards. Just don't leave off the last two letters.
Okay. Now, do you have SANE nurses at your facility? Okay, how many?
Currently, we have one sexual assault nurse who's pediatric, adolescent, and adult certified, which basically means from the cradle to the grave.
Okay.
And then we have one nurse who is adolescent and adult, which is 13 years of age and up.
Okay. Just for explanation, would you, so that our audience won't have to ask this later, explain what a SANE nurse is and what it means?
A SANE nurse is a sexual assault nurse examiner. Most of the time, I will just tell people I'm a forensic nurse, because people know what that is. But when you say I'm a SANE nurse,
They think they're insane.
They don't understand.
Okay.
And we have a lot of domestic violence and elder abuse that need that documentation of injuries and the photographs and evidence collected. Nobody thinks to call a, quote, SANE nurse because she wasn't sexually assaulted. So that's why we've tried to get away from SANE and use the forensic nursing.
Okay. Also, in your forensic nurses, with male and female nurses, this is a social question, but it goes back around to the economic, looking at this through an economic lens. When you have a male nurse and a victim of violence that is a female, is there increased trepidation on the cause of the victim when she's being possibly examined by a male when she's traumatized because of a situation with another male?
We're shortly going to find out, because we have one male nurse. After all of these years, we finally have one male who's willing to go to that next level. If he approaches the female and says, I'm going to be doing your exam, are you okay with that, or would you like for me to get a female? We'll have to get a female forensic nurse to come and evaluate her. But from our perspective as healthcare providers, we don't see an issue with it. But from a victim of a violent crime, perpetrated by a male, that absolutely is something that we're going to have to consider.
Good. Thank you, Tessa, very much.